Hello and welcome to this short course on Nordic Hamstring Exercises in preventing hamstring injuries in soccer players. I myself, Dr. Muhammad Amjad Khan, and I am a senior physical therapist working in Saudi Arabia. So let's begin. Let's start with learning the course objectives. What are the objectives of this course? The objectives of this course is to understand the prevalence and impact of hamstring injuries in soccer games or soccer sport, to master the proper techniques and progression of hamstring exercises, to evaluate the scientific evidence supporting the use of Nordic hamstring exercises for injury prevention, to design a practical implementation plan for integrating Nordic hamstring exercises into a soccer training program. Before we could move to the introduction, let's review the brief anatomy of hamstring muscles. As we all know that hamstring muscles lies at the back of our thigh, which is in posterior part of our thigh, and the primary function of hamstring muscles is to flex the knee and extend the hip joint. And it has three components. One is bicep femoris in the lateral side, and semitendinosus and semimembranosus in the medial side of our thigh. Uh, the bicep femoris has two heads. One is long head and short head, which are responsible for flexing the knee and extending the hip, as well as they laterally rotate the hip joint also. Um, Semitendinosus, which lies in the medial part of our thigh, also flexes the knee, extends the hip, and medially rotate the hip joint. Semimembranosus, which is deep to semitendinosus, also flex the knee, extend the hip, and medially rotate the hip as well. The key features of this hamstring component or hamstring group of muscle is they all originate from ischial tuberosity, except the short head of bicep femoris, which is originating from originating from the linea aspera of the femur, and either they insert or attach into lateral part of our knee or the medial part of our knee. As we can see in this picture, bicep femoris is attaching at the lateral head of fibula, and the semitendinosus and semimembranosus are attaching at the medial condyle surface of tibia. And they are all innervated by common peroneal nerve division branch, which is arising from sciatic nerve at the level of L5, S1 and S2. In the terms of injury susceptibility, bicep femoris is the most injured muscle due to overstretching, followed by semimembranosus due to overproduction of strength and power, which is commonly seen in sporting activities like sprinting activities. And semitendinosus is leastly injured because it has more tendinous projection other than muscle belly, if you can see in the picture also. Let's move on to introduction. Hamstring injuries are most prevalent in soccer. Up to 37% of all soccer injuries are related to hamstring injuries, from simple strain to a more serious complete tear. Um, it can also seen in other sports like cricket, baseball, and even tennis also. But the demanding nature of the soccer game itself put hamstring on risk to develop this type of injuries, because this game requires sprinting, cutting movements, speed efforts, and vigorous stretching while kicking the ball or tackling the opponent or defending the ball. There is also high recurrence of injuring hamstring in soccer games, from 12 to 33%. That means from 12 to 33% of hamstring injury which were previously treated or healed or rehabilitated were found to reoccur again. There is financial burden of 45 million euro per season for EPL teams. According to a study of Evaculum et al. In 2020, they found that there is a financial burden of 45 million euro for English Premier teams for one season which lasts from 8 months to almost 1 year. So they have found out, they have estimated this figure as a financial burden. Preventive measures and effective rehabilitation are crucial to minimize or mitigate these financial and competitive loss. Not only a financial loss, it's a competitive loss also. They may lose their star player, or a player can miss a big event which can change his life, or in which he's expected to perform well, or any high event game. Injury mechanism, usually this hamstring injuries occurs during sprinting, cutting and overstretching, and if we can see, soccer requires all these type of activities like sprinting, cutting and overstretching. So bicep femoris is usually injured during overstretching, as we can see while player is kicking the ball, followed by semi-neurosis due to overproduction of strength and power. We can see this in while the player is taking the ball or following the ball from his end to the other end, or running behind the ball. And semitendinosis, which has lowest injury incidence, from 5 to 6% due to the tendinous projection. Risk factors for developing of hamstring injuries in sports, according to Buckner and Bishotti et al. Hamstring injury risk factors are classified as primary injury risk factors, that means which are responsible for injuring the hamstring at the first instance, and these recurrent injury risk factors which are responsible for recurrence of same injury in the same muscle. Other than these factors, there are other factors which are described as modifiable or non-modifiable or bivalent. In modifiable category, we have muscle strength imbalance, inadequate rehabilitation, which can be modified. Muscle strength and inadequate rehabilitation, these factors can be modified. And non-modifiable, age, prior injuries, competition level, which cannot be modified. Bivalent risk factor, which includes fatigue, inadequate warm-up, training mistakes, etc. Hamstring injury prevention program is a structured plan designed to reduce the risk of hamstring injuries, including strains or tears. It has two components: primary prevention and secondary prevention. The primary prevention aims at preventing the first time injuries, and the secondary prevention, which is aiming at reducing the reoccurrence of same injury in the same muscle. Other than this, there are some other strategies which are proprioceptive balance training, sport specific drills, functional trainings, stretchings, strengthenings and massage, etc. But Nordic hamstring injury stands superior to all prevention programs which are currently available worldwide. It reduces the rate of hamstring injuries or incidence rate of hamstring injuries up to 51%. So there is a well established evidence from different source of trials or different source of research papers. Eccentric training or eccentric exercise focuses on movements or phases of a movement that lengthens the muscle. So if you see in the lowering phase of Nordic hamstring exercise, the muscle is under lengthening under tension. So these type of exercises are proven to reduce the risk of hamstring injuries or lower the hamstring injury rates in soccer players, in other sports also. A case study performed by Muelis et al. In 2004, they try to compare the effect of two exercises, which is eccentric exercises and concentric exercises. So, in improving the strength of hamstring muscle. So they conducted a study for 2 weeks. They randomized participants into two groups. One group was doing the traditional hamstring curls, which is a concentric type of muscle exercise or activity, and the other group was doing the hamstring Nordic hamstring exercise, which is a eccentric type of muscle exercise. So what they found, that the group which was doing Nordic hamstring exercise, there was an 11% increase in eccentric hamstring torque, or strength of the 7% strength, 7% of increase in strength of isometric hamstring strength at 90 degree, 60 degree and 30 degree of knee flexion. So they concluded that hamstring muscle strength, Nordic hamstring training for 10 weeks more effectively develops maximal eccentric hamstring strength. So this is how the Nordic hamstring exercises are working or proving their efficiency in lowering the rate of hamstring injuries in sports and other sports also. So let's be familiar with Nordic hamstring exercises. So Nordic hamstring exercises are which are eccentric type of exercise, which requires particularly while doing hamstring exercises, which requires the lowering of upper part of the body. The benefit of these exercises, it improves eccentric strength and fascicle length, and this has been proven by many studies which are looking at the architecture properties of hamstring muscle after performing Nordic hamstring or eccentric exercises. There are some studies basically from Van der Horst et al. In 2015 and Al-Attar et al. In 2017, which shows the benefits of these exercises in reducing the risk of or incidence of in lowering the risk and incidence of hamstring injuries in soccer players especially. So these studies we will be looking in coming slides. So let's see how to perform Nordic hamstring exercise. This is me asking my colleague to demonstrate or perform Nordic hamstring exercise. In preparation, let the patient kneel on a padded surface, secure the feet once he take the kneeling posture. As a starting posture, keep the hips extended and the body in straight line from head to knees, because you are in kneeling posture. Engage the core. Don't let the patient to be in a slouch position or diverted on either any side of the body. Let the spine in a erect posture for engaging the core or spinal stability. And so once the patient or client assume this posture, kneeling posture, there is a phase called eccentric phase which follows a slowly lowering the torso towards the floor by hinging at the knees. Okay, and then resist the gravity. Once you go in this posture, it's very hard to resist the gravity. So for a period of 3 to 5 seconds, just be in this posture, in a descended posture. After that, there is upward return phase which pushes your hamstring to return to kneeling posture. So while we are going to lowering phase, while we are coming from lowering phase to the upward phase, this is the phase where the hamstring is returning to kneeling posture, or hamstring is working up to maximum. Try not to use the hands for assistance. Try not to push your hands on the floor. Safety tips: warm up thoroughly and maintain neutral position of spine to prevent injury. This is the main or major key point while performing the Nordic hamstring exercise, or major safety tip. So let's see how to perform in this video. To perform Nordic hamstrings, ask the person or patient to first assume kneeling posture. Just okay, and then once he assume kneeling posture, just bring it. Okay. Stabilize his both foots. Okay, and ask the patient to just decline the body, lower the body. Yes, and after that we will come back. Okay, and repeat again. Full. Okay, and then in the same posture. And come back also. Okay. This is how we perform Nordic hamstring. This is an eccentric type of exercises which is loading the hamstring muscles eccentrically. Okay. And according to the research, it has been seen that or shown that the eccentric activities are of hamstrings are very good for loading the hamstring, and which will perhaps helps in strengthening the hamstrings, and which will lead to reduction of hamstring injuries. To perform Nordic hamstrings, ask the person or patient to first assume kneeling posture. If we look at the studies which are examining or evaluating the effectiveness of Nordic hamstring exercises on hamstring injuries in soccer players, there is a randomized control trial conducted by Weinderhorst et al. In 2015. This study recruited 579 players consisting of 40 football teams. This is a cluster type of study. They divided these 40 teams to intervention and control group, 20 teams to the each group, and the intervention group was instructed to perform 25 sessions of Nordic hamstring exercises in a 13-week of period. So what significantly they found that there was a significant reduction of hamstring injuries in the intervention group compared to the control group. So these results and reporting of these studies, this highlights the importance of effectiveness of Nordic hamstring exercises in reducing the hamstring injury rates. And there is one more study. This is a systemic review and meta-analysis done by Al-Attar et al. In 2017. This study included 5 RCTs, standard level RCTs in their study, and they try to look the effect of or examine the effect of or investigate the effect of Nordic hamstring exercises on hamstring injury rate in soccer players. This study significantly reports 51% decrease of Nordic hamstring exercises from all 5 studies as compared to the control group. So this is the importance of Nordic hamstring exercises incorporating in regular soccer training or regular exercise regime or program of the soccer players. Influence of Nordic hamstring exercises on muscle architecture. A study done by Medeiros et al. In 2020, they examined the difference between performing Nordic hamstring exercises once a week or twice a week. I mean, they want to look what are the architecture benefits of Nordic hamstring exercises. Does it increases any physical length or any increase in the muscle bulk or power? It's just the power. So what they have done is they recruited 32 football players ranging from 18 to 23 years of age, and they divided these 32 players into 2 different groups. Group 1 which will perform Nordic hamstring exercises once a week, and group 2 consisting of 17 players which will perform twice a week the same exercise, Nordic hamstring exercise, for a period of 8 weeks. What they have concluded that only Nordic hamstring exercises training program performed twice a week strengthen the hamstring of high level football players. The recruited players were high level football players, while similar changes in muscle architecture occurred with short once and twice weekly sessions. So this was the results from is the this was the conclusion of results from their study, that Nordic hamstring exercise, if we perform at once a week or twice a week for a period of even 8 weeks, it can increase fascicle length. This is the meaning of architecture properties of a muscle. It can increase the fascicle length of the bicep femoris. They particularly reporting increase in fascicle length of bicep femoris. Perhaps it will also increase the eccentric knee flexor strength and eccentric strength of Nordic hamstring exercises. The aim of highlighting this paper is to show, or is to interpret, or is to put in focus that what is the effect of if we perform a Nordic hamstring exercise just once a week. Even a once a week of Nordic hamstring exercise can increase fascicle length, especially in bicep femoris. Training volume and compliance. What should be the training volume of performing Nordic hamstring exercises? Uh, these figures has been adopted from the study of Van der Horst et al. 2015. What they have reported is optimal dosage, or what they have adopted was the optimal dosage of 25 sessions over a period of 13 weeks, and they have reported compliance. Compliance is the main key in increasing the effectiveness of exercise. Any exercise or any program, if there is a high level of compliance or high level of adherence, the effectiveness will increase. Challenges, yes, this exercise can possess some challenges like muscle soreness and fatigue, because you are exercising your muscle in eccentric position. So eventually it will have sort of soreness and fatigue. Practical tips to perform Nordic hamstring exercises, or to implement Nordic hamstring exercises. Start with 1 to 2 sessions per week, either if you are performing for yourself or you are incorporating with any soccer teams or football teams or any other sports teams. So just start with 1 to 2 sessions per week and gradually increase the intensity and volume over the weeks. And this is very much important to monitor the compliance, to track the adherence ratio or adherence level. Ensure that 75% of compliance, as seen from the previous studies, there was a compliance or adherence rate of up to 70 and 75%. Try not to come down from this level to have a maximum effectiveness of this exercise. Combining with other drills, these Nordic hamstring exercises can be integrated with other form of exercises or activities like strength, balance, and agility training also. Benefits of Nordic hamstring exercises, as we have seen from the previous research papers, and we have learned that Nordic hamstring exercises has many benefits, including the physical benefits, which increases the eccentric strength of hamstrings, improves the fascicle length of bicep femoris, as was described by the study of Medeiros et al. 2020. Performance benefits, yes, there is a lot of studies which are reporting the improvement in performance after adopting the Nordic hamstring exercises or incorporating the Nordic hamstring exercises in their regular practice, enhancing the sprinting and change of direction. This could be perhaps a striking future, or striking a benefit of Nordic hamstring exercises, especially in competitive sports like rugby or football, or other forms of competitive sports which needs sprinting and change of direction, suddenly change of direction. So incorporating Nordic hamstring exercises will be of great value or great benefit. Injury prevention, as established by the previous research, it can decrease the rate of injuries, hamstring injuries, up to 51%, and even more than 51% also some studies are reporting. Challenges of Nordic hamstring exercises implementation, particularly if you are working as a physical therapist or a strength and conditioning coach or a football coach itself to any team or any club. There are certain challenges which should be kept in mind or should be expected while implementing these exercises as a training program or incorporating these exercises into the regular training program of soccer athletes or football athletes. The first challenge is muscle soreness, because this is a eccentric nature of exercises which can cause delayed onset of muscle soreness, and it requires consistent adherence. Compliance, the adherence to the exercise should be consistent to increase the effectiveness of these exercises in preventing the hamstring injuries. Unfortunately, a study done by Al-Attar et al. They found that only 45.4% of players globally, athletes globally, they are aware of Nordic hamstring exercises. So there is a increase, there is a need of awareness to these exercises globally. We have reached to the conclusion part of this presentation. In conclusion, Nordic hamstring exercises are highly effective in reducing hamstring injuries, and we have seen, and it has been proven from different studies, like randomized control studies and systemic reviews and meta-analysis. Improves eccentric strength and muscle architecture. Yes, this has also been proved from the previous studies. Requires consistent adherence for optimal results. Consistent adherence is the key for any exercise, especially the Nordic hamstring exercises, to reduce the injury rate or incidence rate of hamstring injuries, especially in soccer players, and it can also be adopted in other games also. This is the list of references which I have taken citations, or which helped me in preparing this presentation. So you can go through this list for better review and for the better understanding of Nordic hamstring exercises. And this is a brief biography or a brief introduction to myself.